Good morning, Sarah. How are you doing today?
Hey, I'm doing pretty good. How about you?
I'm pretty good. Let me just get us started here. My name's Amanda. I'm the clinical nurse specialist that's been assigned to this appointment today. I'm going to be meeting with you and talking about your discharge of the person that you caretake for. I just want to do a quick setup and let us take a look at our environment. And how is your equipment working today? You can see me, you can hear me.
Yeah, my equipment's working good. I can see and hear you. Are you able to see and hear me okay?
I can see you and I can hear you as well. Are you in a secure environment with the door closed?
Yes, ma'am. My door is closed and so is my window.
Okay, and nobody can hear you. You're feeling like you're in a private space.
Yes, ma'am.
Okay. I should also ask that your are you at your home address today or at the person you're providing care for at their address today?
Yeah, my mom, she just got discharged from the hospital with this asthma, which is why I wanted to meet with you, but I'm currently at her house right now.
Okay, and that's in Virginia.
Yes.
Great. Okay, so let's talk about your discharge. What brings you to this appointment today?
So when they were doing the discharge instructions with my mom, I was there and listening, but it just didn't seem to be cover everything I needed it to cover. Like I understand that there's medication she has to take every day, and I understand there's rescue inhaler. I've seen it used in like the movies and stuff where like they get the wheeziness and they inhale, but it just I was lost on what exactly I'm supposed to do to keep her safe at home.
Okay.
And we don't have like a follow up plan really in place. So I just wanted to touch base with you and see what we can figure out.
Wow, that must be really frustrating and a little scary to arrive home and not feel like you are ready for the next steps and able to take care of your mom. I'm sorry that happened to you.
Thank you. I appreciate hearing that, but it sounds like you'll actually listen, unlike the people
Well,
at the hospital.
that's my goal here today. I want to make sure that you feel heard and I want to address some of your concerns. So it sounds like to me you're feeling like you know how to help your mom through a rescue inhaler moment if she's having some exacerbations, but you'd like to try to address things you can do in your house and in your life to prevent asthma attacks at all.
Yeah, because the last thing I want is for her to get back in the hospital and for something that I didn't even know I could prevent. Like, and I don't even know how to prevent any of
Okay.
this. No.
So let's go through a couple things. What I'm going to do is ask you some questions about your living situation and your environment, and we'll take a look at what's going on, what could be triggering her. Do you already know of things that make her asthma worse? Have you ever been around a lot of dust or a lot of pollen or any kind of like temperature fluctuations, or are there any smokers in the house?
Well, so this is the first time, like when she went to the hospital, that was the first time I've ever seen her like not be able to breathe.
Okay.
Usually, if she's dusting, sometimes she'll get a little cough when she dusts, but she takes a little Benadryl and it goes away. Um, we don't smoke in the home. We do have two cats here, and we've had those since even I was a little girl. My mom loves cats, so she's always had them.
Yeah.
Those don't seem to bother her. We
Okay,
don't
so that could be the cats could be a potential trigger. Without specific allergy testing, we wouldn't know for sure. But even over time, your allergy response, your asthmatic response can get a little worse over time. And then the dust, even though, if you're dusting kind of regularly, even just kicking it up while she's dusting, it could be a problem. What about things outside the home? What about activities where she might be exposed to pollen or trees or grass?
well, we have a beautiful garden in the backyard, and she loves to be in the garden, especially in the spring and summer. Um, it's she sometimes says that she feels a little short of breath after working in the garden, but she takes a
Okay.
warm shower afterwards, which seems to help.
Okay.
But I've never thought it was asthma. I just thought she had some pollen allergies.
Well, the asthma is definitely going to be the swelling of the airway in response to some sort of an irritant, right? And that is where she's going to have the attack. So even if we can't identify exactly what's causing it, or even if you don't know exactly what brought her into the hospital to begin with, there's a few things we can do for your environment to just reduce potential for that swelling of the airway that will make things bring on an asthma attack. Um, so a few things that we could talk about right away are what she's doing when she's gardening. She can wear a mask when she's gardening to kind of prevent some of that pollen entering her face. She can also keep the pet dander to a minimum by maybe having you or somebody else groom the cat regularly and clean up pet hair along the way. We could also talk about the dust mites. I think that depending on her home care routine, there's a few things we can do. One of the best things you can do is get an air purifier and set up an air purifier in the house. Do you have an air purifier already?
No, I haven't even heard of an air purifier before.
Okay, so if we get an air purifier, if you have access to funds to buy an air purifier, and we can talk about, if you don't, we can talk about some resources for that. But in terms of an air purifier, you can get a HEPA filter. So it's a filtration that's very, very dense, and putting the air filters in the rooms, especially where the cats are and where your mom spends the most amount of time. So I would say in the main living space and in the bedroom where she's getting sleep. Keeping an air purifier will really help prevent those exacerbations. How does that feel? How does that sound?
Um, I think it sounds good. I'll look into those air purifiers. They probably sell them on Amazon. I don't think funds will be an issue right now. She gets her disability and her retirement check, and I'm working full time, so I'm sure we can make that
Great.
work.
Oh,
I'm
that's
just a little,
wonderful. You can support her that way.
yeah, I'm just a little worried. She's one of those anti-maskers, so I don't know if she'll really be interested in wearing a mask when she gardens, but maybe
Mm,
I can talk to her and, explain to her why it's important.
okay. I think if we start with the air filter and offer a mask, maybe we can reframe how we're using the mask, that it's not about germs and it's more about prevention of the inflammation of her airway, and that there's a lot of things we can't see in the air, and maybe that would help. A couple other ideas I have are back to related to the cleaning. If there's any mold in the house, is there any kind of mold anywhere in the walls, in the showers,
Okay.
visible black spots?
The shower gets a little mildewy. It's so hard trying to keep the humidity down in that bathroom. Like we've tried dehumidifiers and plants, and it stays so stuffy in there.
Okay.
So it does get mildew and sometimes mold, especially just in like the cracks.
Okay. Well, it sounds like your plate is already really full caretaking for your mom. And if funds aren't an issue, what about hiring a professional cleaner to come and take care of some of that mold on a regular basis? Does that sound like something your family could do?
Um, I think so. I'll talk to my mom about it. I don't know how she'll feel about that, but I think it's a good idea to at least try. I think
Okay.
you're right.
Any kind of these things that are kind of these invisible potentials, right? And if we're talking about, again, reducing the risk of an asthma exacerbation, of her getting to the point where she can't breathe, and we're just reducing risk, right? So anything that we can do to reduce risk, and we don't want your mom to be doing that work because we don't want her exposed to that, and your plate is already full. So depending on how you're feeling, if you feel like you have the capacity to add in some cleaning, protect yourself. If there's mold, you can wear a mask, or hiring somebody professionally to come evaluate if there's mold and treat mold as necessary would be very helpful. And you already spoke a little bit to the humidity. That was the next thing I was going to bring up, is that it's funny because we're trying to dehumidify your bathroom, but sleeping in a humid environment for asthmatics in the night can be very helpful, especially if it's cool. There's cool mist humidification that can really reduce the airway swelling and can help her during the day through her day if she's sleeping in a cool mist humidifier environment. Do you already have a humidifier going for her at night?
We don't, but I do have a humidifier that I used for my daughter when she was a baby. So I could bring that over and we could try
Yeah.
that.
That would be great. It's you don't have to add any cost if you're already going over setting up the cool mist, even just leaving it in her room. And then throughout the day, going ahead and airing it out because then we don't want to go too far and have mold. So cleaning out the humidifier regularly, keeping that cool mist going and at nighttime, and then taking breaks during the day and really allowing the room to dry out and air out will help prevent going too far the other direction towards mold, right?
Okay. So only
Um,
on at night when she's sleeping, and then during the
yeah,
day we turn it off.
yeah.
Okay.
So let's talk a little bit about her medications. We talked about the rescue inhaler. Did they send you home on any kind of medications for maintenance, for keeping her asthma reduced?
Oh, they sent us home with that little pill. It's a little square.
Okay.
Not humabid. I don't remember. But she's supposed to take that every day.
Okay.
Monty, Monta, not
Okay.
Monterey,
I'm not
Montaluca. Yeah,
okay.
that one.
That's unfamiliar to me. I'm usually used to there being a maintenance inhaler, like maybe an inhaled corticosteroid. Did they give you one that is an inhaler that she's supposed to take at night, in the morning or evening, or just the pill?
Um, yeah, they did give us two inhalers. I know the one is the rescue inhaler. We have to take that everywhere with us. The other one, it was like something, Palmacort.
On the court. Okay, so we have two things. So your square pill sounds like it's going to be for your maintenance, and I'll double check with your provider because I don't prescribe. So I'll double check with your provider and make sure. But if according to your medication list, she is supposed to be taking that every day. Do you know that she's taking it every day?
Yeah, she's got a big pill box that she keeps all her meds in, and
Okay,
she
so
takes them every night.
great. So she's keeping up on that one. Sorry, I didn't mean to cut you off.
Oh,
My video delayed it slightly. Okay, great. So then the other thing is the Pulmicort. We want to make sure that she's taking her Pulmicort regularly. Is that something that she's taking in the morning or morning and evening at this point?
I think she's taking that in the morning when she first wakes up. I know that she can't she has to wash her mouth out afterwards, so she says she does it right before she brushes her teeth.
Okay, perfect. So that's something that will also help. It's not necessarily environmental in your home, but these are ways that we can regulate her asthma symptoms and keep another attack like that at bay. So it sounds like you're already doing a really good job with her medication management. Good job. I know it's a lot. Um, so finally, one of the things I wanted to bring up is it sounds like you left the hospital without a lot of support, without a safety net. And I would love to set you up with an option for some support because we're meeting today, but I want to refer you out to an asthma and allergy alliance and association. There is a company that has an app on a smartphone. Do you and your mom use smartphones well?
Yeah, I do. She tries, but I'm usually the one helping her.
Okay. Well, depending on how this sets up for the both of you, this could be a really great thing for both of you to learn together. The Asthma and Allergy Alliance has a 8-week coaching program that is all self-managed and is completely free and helps you manage your asthma symptoms. And I can, in the after visit summary, I can send you a link to this association so that you can download it on your phone. And maybe when you're there with your mom, you guys can look at some of these management tips together so that you're both on the same page. And as her caregiver, and also for her as being in charge a little bit more of her own care, there's some weight of some of this that you can pass on to her so she can feel like she's really, autonomous over her own care.
Okay. Yeah, I think that's a great tool to have. And you said that's coming through her My Chart, right?
Yep, I'll send it through my chart and I will send a link. And if you have any trouble, send me a message and let me know that you couldn't get it and I'll find a new way to get it to you.
Okay. Well, thank you.
Um, no, no problem. I'm so happy. So let's go over a couple of things for our visit today. We've talked about some environmental triggers. Do you feel like you have a better understanding about environmental triggers and things you can do in your home to reduce risk?
Yeah, I'm realizing that there's a lot more things that we didn't even think about that could be a risk to her. So I'll start educating her on that and getting her some tools to help manage some of the triggers.
Okay. And then the other thing that we can do for this takeaway is to have you as her caregiver and her monitoring her own asthma symptoms and keeping a little log of when something triggers her, when she needs to take a rescue inhaler, write it down what she was doing. You may start to see trends where, oh, 5 times last week when I was out in the garden, I had to come in and use my albuterol. Maybe there's something in the garden that's really bothering her. Or every time I went to the bathroom, I felt a little itchy in my throat or a little like I kind of had to cough. Things that are environmental triggers will show up in trends if you keep track. So that's a self-management skill that she can do that won't take a lot of work if she just keeps a little paper tablet or a note in her phone if she like, but like you said, she might not do as well with her phone, but if she keeps a little paper tablet and then at the end of say a week, you guys can go through and just say like when she had to use her rescue inhaler, every time she had to use it, what was she doing? And you might get some more information.
Okay. All right. So we're gonna start keeping a log to help find out what's really triggering her. We're gonna look into maid services and I'm bringing the humidifier over, and then we also wanted you said it was a HEPA filter,
An
air
air
purifier.
purifier with a HEPA filter. Yep. You've
Okay.
got all the things. So
All
what I
right.
would like to do is schedule a follow-up appointment with you in about 4 weeks and see how we're doing, where we're at, if your mom's had any exacerbations, and see if after looking at some of these trends, we've been able to see things that have popped up, things that she might be exposing herself to without realizing it. And then we'll also see how the air purifiers are helping if there's, reduction in her use of her rescue inhaler, keep up with her regular medication and maintenance inhalers. And then we'll talk in about 4 weeks and see how she's doing.
Okay. That sounds good to me. I look forward to talking to you in 4 weeks.
Okay. Do you have any other questions, concerns, anything else you want to bring up today?
I don't think so. I think I covered everything. Thanks.
Awesome. Okay, so I will do a after visit summary and I will just do a quick call with your healthcare team, let them know what I've learned today and collaborate with the rest of the team and see if there's anybody else that we would want to pull in on this case before we meet up in 4 weeks. All
Thank
right.
you.
I will have our scheduling team call you and make that appointment.
Awesome. I appreciate it. Thank you so much.
You're welcome. Bye.
Bye.
Fine.
Hi, Heather. How are you today?
Hi, Sarah. I'm doing okay. How are you today?
I'm doing good. So my name is Sarah. I'm a clinical nurse specialist with the allergy and asthma team here at the university. It sounds like you had some concerns that we would like to discuss. But before that, I just wanted to check and make sure. Can you see and hear me okay?
Yeah, I can see and hear you. Can you see me too?
I, yes, I can
Okay,
see and hear you.
great.
It sounds like we have a good connection. And are you in a place that is secure right now and private?
Yeah, I right now I'm the only one home. I'm sitting in the office space. I'm the only one here right now, so it's good.
Okay, good. And the last thing I wanted to double check, my office, they sent you over the consent form, correct?
Yeah, that was something they sent me in an email and they had me go there was a link and I had to go and fill something out and then it just I guess it automatically sent to you guys?
Yes, so I did review your chart. It did look like we had the consent on file. I just wanted to make sure that you kind of understand that telehealth is a little bit different than in-person visits. Because of that, we do ask you not record, you keep your phone on silent, and we try to
Okay.
minimize disruptions.
Okay, sounds good. Yeah, I like that. This is new technology, so it's kind of neat that I can be at a provider appointment, but not necessarily be there in person. It's really kind of neat.
Right, yeah. I think of it like the old times when they used to have the doctors come to the houses. It's kind of like that, but virtually now.
Yeah, that's
um,
kind of neat.
yeah, so um, what concerns do you have right now?
Well, with this asthma diagnosis for my son, he's in ninth grade. This is
Mhm.
all new to us. I mean, I heard about other kids with asthma, and he ended up in the hospital for just an overnight, just because he was having a hard time breathing. He's in the marching band, so and he plays an instrument, so he's always blowing air and doing stuff. But he was just having all these issues, and we didn't realize that. Yeah, it actually some of this is asthma related, and it's just a little overwhelming with we've got these 2 inhalers. He's supposed to take this one twice a day, and this one he takes as he needs it. And then, the nurse when we got discharged just gave us a big packet of paperwork. And I'm not a healthcare provider. I work in a totally different field, but some of this was just a lot. And I just want to make sure because he's in marching band that he can actually keep doing this and still be able to breathe, that we're not going back to the hospital with all these other breathing issues, and just making sure that we have for him what he needs to be able to thrive and do well. So just
Mhm.
kind of a little overwhelmed and just concerned that are we on the right path? Do we need to involve other people? Do we need different medicines, that kind of thing?
Yeah. Yeah, you're right. That does sound overwhelming. And I have to say, I commend you. You're a great mother for handling all of this and really wanting to keep him in the sports and the things that he loves.
Yeah.
So let's start with the medications. It sounds like they prescribed 2 inhalers. Do you remember the names of those?
They sent him an Advair inhaler. It's the little one. He pull it over and he breathes that in, and then he has to wash his mouth out, just rinse it out. And he does
Mm-hmm.
that one twice a day. And then he's got the other one. They called it the puffer. Albert something, I think is albuterol. And
Okay,
they
yeah.
said to do 2 puffs of that if he's feeling short of air, just because it's not one to use all the time, but it's just use it if he was starting to feel shorter air, and just 2 puffs every, I think the box said every 4 or 5 hours. And those were the two they gave him. And they also prescribed him some Claritin to help with any seasonal allergies.
Okay. So it sounds like you have a good foundation for his medication regimen. The Advair, like you said, that he takes twice a day, that will be his maintenance inhaler. So that is the inhaler that is keeping his airways open just on a maintenance level, and helping to provide, an easier time breathing throughout the day.
Okay.
Um, I'm glad that he's rinsing his mouth out, because it has a steroid in it. It can cause what we call thrush, which is just white patchy fungus that can grow on the tongue.
Oh,
So that is
well,
one thing that I'm glad you're doing that because we definitely
yeah,
want to fix
well, and
that.
teenagers, and we would need to just do whatever we can, and sometimes they'll listen and sometimes they won't. But even the pharmacist, when we went to Walgreens to pick everything up, even the pharmacist said, make sure you rinse your mouth out after you use this.
Good,
Hopefully he'll
good.
listen.
So the albuterol, you are absolutely correct. It is a rescue inhaler. So it is when he has those breakthrough symptoms that aren't being managed by his other inhaler. So that can include wheezing, shortness of breath. He might feel some tightness in his chest, or he may feel like he's breathing really, really fast. When
Okay.
he's having those symptoms, we highly recommend that he uses that rescue inhaler. Now, obviously, we want him to use it whenever he needs it, but if he's using it more than 3 times a week, come back to us because it sounds like what he's currently using isn't managing his.
So what do I need to do if we use this rescue inhaler and things are not getting better? Do I just take him back to urgent care? If he
So that Sorry about that. I didn't mean to interrupt
Yeah.
you. Yeah, so that would be a good option is either taking him back to his primary care or to an urgent care. I would
Okay.
recommend those over the ER just because the ER you might be waiting for a few hours and the copay is a little bit higher.
Okay.
Usually PCPs at urgent cares have the equipment to run what's called a nebulizer treatment.
Oh, okay. Yeah,
That,
they gave him that at the hospital, the little mask that he put on his face and that,
yeah,
it was running and it had like little smoky things coming out of the top.
yeah, so that aerosolizes the medication, and those medications are a little bit stronger. Sometimes there's multiple medications that
Okay.
they use at the same time, and it really gets in there and it opens up all those airways.
Okay.
Um, if it gets too bad to the point that you can't manage it at home without the nebulizers, there are home nebulizer treatment options.
Okay.
But you want to start right now with just the Advair and the albuterol and see if
Okay.
that works.
Okay, well, that's good to know. Okay, that's really good to know.
Yeah.
So what do we need to do here at home? That the packet that they gave me had all kinds of things about cleaning the house and if you've got pets and I mean we've got two big dogs. We've got golden doodles and they don't really shed and we take them to the groomers routinely because they have to be clipped. So they don't really shed and we used to have dogs that did shed a lot. Um we don't have a lot of carpet in the house anymore, but we do have a bunch of, we have some rugs and whatnot. And, this past spring and into the summer, the allergies were really, really bad. I mean, my car was covered in yellow pollen and you could just see the yellow pollen all over everything. We think that's kind of when all of this started. So what do I need to do here at home to make it better that we don't have all these asthma issues, these breathing issues?
Yeah, no, that's absolutely valid questions, and that's actually one of the places that most people don't realize, but can make the biggest difference. So we'll actually start with the allergies because you did mention that he was prescribed Claritin.
Yeah.
So those seasonal allergies, has he had those for a long time?
It seems like they've just been on and off, and it got worse when we moved here about 3 years ago.
Okay.
Where we used to live, he'd just get like occasionally like some runny nose, maybe a little cough and congestion, but we weren't really having the breathing issues. And then when we moved here that first spring, where the neighbors were telling me it was called the pollinating because all the trees would dump this bright yellow pollen on everything, and they warned me to, keep your house closed up. Don't open your windows until it's all gone. So he may looking back, yeah, I would say he's probably had some allergies, but we really hadn't seen anything much about it until earlier this year. My neighbor told me this year and all the years that she's lived here that the allergies were some of the worst she had seen in a long time.
Yeah, the air quality has been really bad this year. So it's good that you have the Claritin for him. So the Claritin will help reduce that allergic reaction that he's having to the pollen. The reason that's important is because whenever he has an allergic reaction, that can also cause an asthma attack
Oh, okay.
because of the inflammatory process that happens in the throat and in the lungs with the allergies can trigger that swelling that can cause him to have a hard time breathing.
Yeah,
So
the nurse
yeah,
sort of mentioned that. She didn't explain it that way, that an allergy attack can cause an asthma attack. She just said allergies sometimes can be a real problem with asthma. It's like, "Oh, okay. Well, how do we treat the allergies?" And that's how we got the Claritin.
good. Yeah, I'm glad that she gave you the Claritin, especially during the spring and the fall when we have a lot of pollen. Make sure that he's taking that Claritin once a day. That'll
Okay.
help reduce his asthma. I heard you say you had dogs that were golden doodles.
Yeah.
That's good because they're lower in dander and they don't shed as much. But pet dander is also a common trigger.
Oh,
Um,
okay.
yeah, it's we see it a lot, especially with cats. But dogs can trigger it as well. Does he sleep with the dogs, or do they sleep in his room on his
No,
bed?
they don't
Out?
they do go into his room and jump up on his bed, but they don't sleep in there. They like to be in there if they're upstairs and he's in his room. They'll climb up on there and just they'll do a little snuggles and but no, they don't sleep in his room. They sleep in my bedroom with my husband and I.
All right, so there's a few different options then that we can do to help reduce the pet dander, especially in your son's room. That'll probably be the area that we focus on the most, since
Okay.
that's his dedicated space. So we can keep the dogs out.
Okay.
So maybe closing the door when he's not in there, or when he is in there, closing the door. Maybe putting a baby gate up.
Oh, that's a
Um,
good idea.
we can also look at, if finances permit, an air purifier with a HEPA filter. We can put that in his room, and what that'll do is it will purify the air in his room to get rid of the dust, dander, and allergens that may be
Okay.
in that area.
Okay,
Um,
we can look into one. I'm sure with Amazon Prime, there's something we can find that's not overly expensive.
yeah, yeah, I'm sure, especially with Prime Day deal coming up,
Yeah.
I'm sure there's options. You may consider putting one in the main living area as well, again, if it permits. Um, it sounds like you guys had already ripped up the carpet, which is great. I
Yeah,
am
we
not a fan
bought
of
this.
carpet.
Yeah, when we bought this house, it didn't have a whole lot of carpet. It's now it does have carpet in the bedrooms. It's
Okay,
just a low carpet. It's not like fluffy carpet. It's just a low carpet. And it doesn't smell or anything and we vacuum regularly.
good. Yeah, I'm glad to hear that you're vacuuming regularly. Vacuuming, especially the carpets, will help get the dander and dirt and stuff. Even if you keep your carpets really clean, they can still hold on to that dirt and those dust mites. So regularly vacuuming, which it sounds like you're already doing. Do you have a carpet shampooer or a steamer?
We've been talking about getting one just to help keep, especially like some of the area rugs a little cleaner. A friend of mine, she said she found one at Target that was really good. And I've been thinking about getting one. She said it's really easy to use just to put the water in and a little bit of the cleaner. And she said she uses it on the carpet and it works great. So we've been talking about getting one. I guess maybe I should actually just go out and actually get one.
Yeah, I mean, it's as long as you have the finances to do it, and if you don't, we do have resources available to help you with
Oh,
that.
okay, that's good to
Um,
know. Thank you.
yeah,
We can check the budget and we might be able to swing one coming up. I have a bonus coming in for work and that should be, a few $100s, so we might be able to use the bonus to get one.
great. Okay. All right. Are there any places in your house that you've noticed has mildew or mold or like black spots on the walls, ceilings, floor, anything like that?
I don't think I've noticed anything in the past. The bathrooms when that had already been remodeled when we purchased this home, and
Mhm.
they've got white tiles. So I think if there was mold or mildew, we'd see it, but I don't recall seeing any black or mold or anything on everything. We do get that occasionally that orangey film on a few things that my neighbor said it's actually a bacteria and just to use like bleach or vinegar to clean the bacteria. She said it's pretty common here just because of the high humidity and stuff. So we
Okay.
don't see that. You see it all the time in the toilet, that orangey ring but no mold or anything. I've not seen that.
Okay. So, and you said it was like an orangey substance that you
Yeah, the
find?
neighbor told us she's lived here, like, for almost 30 years, and she said, "Yeah, it's just a type of a bacteria that shows up," and she said, you clean it with bleach or vinegar," and she said it goes away, and we did that, we just used some bleach cleaner, and it went away, but every now and then it'll show back up, like, maybe a couple times a year, but we almost always see it, like, in the toilet, but I don't see it anywhere else in the house.
Okay. All right. Is it just one toilet that's affected, or is it all the toilets?
Usually it's the downstairs bathroom that we see it, and that's just like that's a little half bathroom just with the sink and the toilet. I don't think we see it in the upstairs bathrooms at all.
Okay. And he typically uses the upstairs bathrooms, is that
Yeah,
correct? Okay.
he and his, older brother share the one bathroom here in the hall.
Okay. Yeah. That sounds good then. I'm going to be very transparent. I'm not actually sure what that orange stuff is. I will do a little bit more research into
Oh,
it, but
okay.
in the meantime, because I don't know what it is and I'm concerned it might trigger his asthma, let's keep him out of that bathroom until we can identify
Okay,
it.
okay. That sounds like I said, we cleaned it with some bleach, and I haven't seen it in at least 2 or 3 months, so,
Okay, good. It sounds like the bleach is a good solution then, and
yeah.
keep doing that. So, all right. Well, are there any other environmental concerns in your home that you have?
Um, I don't really think so. Nobody here smokes. I mean, the neighbor down the street does, but if he's smoking, he tends to stay away from all the kids or whatnot. But nobody
Okay,
here smokes. If we have company who do smoke, they go outside. They don't do it in the
good.
house. And but I think just the biggest one is just making sure that, whatever we decide to do, it's going to help keep these asthma attacks down. And
Mhm.
especially with, he plays trombone, and we want to make sure the band director told us to make sure that he has his rescue inhaler with him at all times. And there's one of the other parents, she's really nice, she's a nurse, and she has on his little medical card now that he was recently diagnosed with asthma. And
Okay,
she makes sure that he has his inhaler on him at all times too. So
good.
that's been helpful. I just know with band, they're outside a lot, and I can't always control that environment, but
Right.
I was just like, well, what can we control? Because
Mhm.
he's a teenager, he's gonna kind of do what he wants to do
Right.
to an extent. So I guess my question is just making sure that we keep, what we do everything we can to keep him out of going to urgent care and stuff. So it sounds like
Right.
if we can find these air filters and put one in his room and one down in the TV room, that should help. And we'll look into getting a carpet cleaner. And that's a good idea. We talked about it. We just hadn't done it yet.
Right.
So
That's
we'll look into that, and then we'll do our best to keep the doggy kids out of his room. That might be a hard one for him because when he's in there and just hanging out, sometimes he likes to have the dogs hang out with him.
right.
So, and on the list that the nurse gave me when we got discharged, she gave me the paper and it said, go to the emergency room for these. I understand that, and I think my husband understands that well too. Um, it
Good.
just making sure that we're doing everything that's right for him,
Mhm.
um, especially with where he enjoys doing band and he enjoys hanging out with his friends. We don't want to stop that. We want him to be able to
Mhm.
continue.
Okay.
Unfortunately, at the hospital, they didn't have any suggestions as to what we could do for band. She's like, "Well, you'll just need to talk to your provider." Well, that's why I'm talking to you.
Okay. Well, good. I'm glad you reached out. I kind of wanted to circle back to the band thing for a few minutes. Have you noticed that he gets short of breath or it's hard for him to breathe when he does a lot of exercise?
That I was thinking about that, and he hadn't really complained a whole lot. He just said, their performance, they're on the field and they're moving when they're doing their performance. Their performance is about 7 minutes long, and he's constantly moving, but he's not always playing his instrument when they're moving.
Mhm.
During their practices, they do take frequent breaks. They may only be playing for a few minutes, and then the band director calls a cut. But he's not really ever complained about feeling short of breath. I guess he sometimes said he would get winded if they were doing a fast movement, but he's made it seem like wasn't the only one of the kids that would get because they're fast walking, not quite running because of
Mhm.
the movements. So, but he
Yeah.
never really complained directly about anything. We just noticed when he came home from practice that one day that he just really was he kept saying he felt short of air at the end of practice, but it didn't get better.
Mhm.
Coming home and just resting, and that's why we ended up going to the hospital, because he started to sound really wheezy. We could hear it when he was breathing. So, but he never really complained about it. Just I don't know if it was just the heat, and they took a lot of breaks, but between the heat and how dry it has been, maybe just something triggered it.
Yeah. Yeah, there's a lot of potential triggers that can happen when he's at band. Like you said, the heat is could be one of them. Also, I'm assuming he practices on a field. If they recently cut the grass, that could also
Yeah,
cause allergies.
I think they did. I think they cut the grass that morning, and then the kids were on it that afternoon.
Okay. So there's a few things that we can do to help mitigate that. Instead of taking the Claritin in the morning, we can take his Claritin an hour before practice. That way it starts setting in as he's on the field to help reduce the chance of him having an allergic reaction, especially if it's warm or if the field has recently been cut. Another thing we can do is look at the air quality index before he goes to
Mhm.
practice. Usually you can get it from your local news station, your local weather station. It's a number, and it goes from 0 to, I want to say, to 100. The highest I've ever seen it is like 64, 65. And it's typically color coded too, which is nice. So it measures the quality of air. If the air quality is higher, like in the 40s, 50s, 60s range, and typically
Mm.
it's color coded as red when we see that, um, that will be a time we really want to limit him being outside,
Okay.
because that means there are more potential triggers in the air for his asthma. Usually we
Okay.
see that in high pollen season and wildfire season. Um,
Okay.
the yellow, when it's in the yellow, so in the moderate range, we say go outside at your discretion. So obviously listen to your body. If you're starting to feel short of breath, let's go back inside and take a little
Okay.
break.
I
Um,
I'll mention that to the band director. I'm sure he notices that things, because the other day when it was really hot, we had several hot days in a row, and they did not practice outside. They actually practiced in the gym
oh,
inside.
good.
In the one day that he was outside, it was still hot, but they were only out there, I think, for not even an hour, and it was something about I'm a band mom, but I don't know all the band stuff, and it was about their markings on the field, just making sure that they were in the right lineups. But
Gotcha.
I'll mention that to the band director during one of our next parent meetings, just to make sure that, because I would guess that there's other kids who do have asthma who are in the band, so I would hope that he pays attention to that, and I'll ask. That's a good one to know. And you said I can just find this on just like a weather report or something?
Yeah, sometimes I've seen it on the news. I've seen it in local weather reports. On my phone, I have a weather app, and when I click on it and scroll down, it has the air quality at the bottom.
Oh,
So
okay.
there's
I'll look for that. I'll look for that on my phone.
um, yeah, I think that would be great. So there's another resource that I wanted to show you. Is it okay if I share my screen?
Yeah, that may be fine.
Okay. All right. So can you see my screen, or can you see my
Yeah,
screen now?
yeah, I can. It's Asthma and Allergy Foundation.
Yes. So this is the Asthma and Allergy Foundation of America website. It is set up for both providers and for patients and caregivers. So
Oh,
there's so many different things here that I think you can look into that might help give you a little extra direction, or if you have a question, it might help answer that.
oh, wow.
So,
I didn't even know
like,
this existed.
yeah, it's really cool. So it has for the asthma under newly diagnosed facts, it has treatment, and it even has some school resources.
Okay.
Um, so there's a couple ways it allows you to get involved. with the community. They have some support groups, I think some that meet
Okay.
locally as well. There's an 8-week coaching program that we can also get you set up with. It's completely free, and you meet with a coach who will help kind of go into more detail with what we've been talking about and managing or evaluating the effectiveness of the treatment.
Oh, that
Um,
would be neat.
yeah.
This
But
I didn't know this existed. This is great.
thank you. Yeah, what I'll do is I will get this link and I will send it to you via my chart. I'll also attach
Okay.
it to your after visit summary, which will get sent to you electronically through the my chart
Oh,
portal.
okay, okay.
All right.
That's great to know, and this may be really good. Because he did mention that there were a couple of kids in the band who did have mild asthma, and so they've all. I guess the other day they were comparing inhalers. You know,
Okay.
who had what inhaler and what color it was.
Mhm.
So I mean, at least he's got some kindred spirits there in the group.
Yeah, that's great. And I also I'm glad that he has people that can support him. And
Hmm.
I really hope that you find someone that can help support you too, because the caregiving role is so important. And people forget, they get so wrapped up in I gotta take care of my kids, or I gotta take care of my parents, or I gotta do this, I gotta that. And they forget I gotta take care of myself too.
Yeah,
So I
that's
really want you to take some time for self-care and just, focus on yourself. You know?
okay. Well, I will, and and I'll make sure that my husband sees all the information there in the summary. That will be a big help. I mean, he's been very supportive. I think he's struggling a little bit with this too, just because of the newness of all of it, and it's just a lot of information. So, but this was helpful. Thank you. I feel a lot less frustrated, I think now, and knowing that there's a lot more resources than just the pieces of paper we were given at discharge.
Right. Yeah. So how does we meet up again in 2 weeks? We can evaluate how the interventions are doing, what's been working for you, what hasn't been. I also want you or your son to keep a log of every time he uses his rescue inhaler
Okay.
and what he was doing, where he was, and if the rescue inhaler helped.
Okay, yeah, I think we can do that. That shouldn't be too difficult. He might even be able to do something on his phone where he can keep a log of when
Yeah.
he has to use that inhaler and what was happening. So yeah, I think we can do that. 2 weeks, I think 2 weeks would be good. How do I make that appointment to see you again in 2 weeks?
Um, if you're comfortable with the telehealth model,
Yeah,
like what we did
I
today,
like this. This is nice.
good. Yeah, I like it too because it doesn't I don't you don't have to come to the office and disrupt your whole day. You can kind of work it in. So just call my office and get in contact with the scheduler. Tell her you want a telehealth visit with me 2 weeks from now,
Okay.
and she'll get that scheduled for you.
Okay, that sounds great. That because when they called me back after a message, I said, "Hey, we can do this appointment virtually on a video chat, and you
Mhm.
don't have to come in." I had a lot of questions, but I think this works great. And you're right; it's not as disruptive sometimes during the day, and I can still get questions answered. So I like this. I'll call and get another one set up. And we'll see how he's been doing and stuff. But so far he's doing good. So let's see how the next couple of weeks go.
Okay, sounds good. Well, it sounds like we got a good plan in place. Is there anything else I can answer for you right now?
I don't think so. This was very helpful. Thank you again, Sarah. I really appreciated this.
Absolutely, no problem. If you have any questions before the 2 weeks, send me a my chart message. Otherwise, I'll see you in 2 weeks.
Okay, thank you. You have a good day.
All right, thank you. You too.
Okay, bye bye.
Bye.
Hi, Amanda. How are you today? My name is Heather. I'm one of the clinical nurse specialists here at the clinic, and I know you reached out for an appointment.
Hi, Heather. Yeah, I reached out for an appointment. I had a stroke and I got discharged and came home and I've been doing my recovery training and I keep feeling like I'm having a hard time with the symptoms.
Okay. Okay. Well, as we're getting started today, number one, can you see and hear me just fine?
Yeah, I can see you.
And I can see and hear you just fine. Are you in a quiet, safe location without interruptions?
Yeah, I'm in my bedroom and the door is closed, but my window is open so I can get some fresh air.
Okay. And I'm the only one here in my office. My office door is closed. So I just wanted to make sure that you know that this is secure. In the text message and email you received for our session today, there should have also been a phone number that if we lose connection, that is a phone number you can call and we can audio only at that time pick up our conversation.
Okay.
And I have a signed consent here from the office that said you agreed to the telehealth appointment.
Yeah,
And
I filled out a electronic signature. I'm pretty tech savvy even though I talk slow.
that's okay. That's perfectly fine. If you see me looking down every now and then, I'm just taking a few notes so I don't forget anything important. It's not that I'm trying to ignore you. I'm just making a few notes on a piece of paper just to let you know. We expect this appointment to last about 20 minutes or so, but if we need some additional time, just let me know. And we can also schedule further appointments for you if we need them.
Okay.
Before we get started, do you have any questions about how the appointment will work? And any questions about the technology, anything of that nature?
No, this feels familiar. I have had online visits
Okay,
before.
that's great to hear. That is wonderful. If you start having an audio or video delay where we've got some lag time, we'll, just we'll work with that as it comes. Hopefully we won't have too many audio or video delays.
Sounds great.
Okay, so just to recap, when were you recently discharged from the hospital after your stroke?
So I got discharged about 4 days ago, and they wanted to do a follow-up visit the same week, but my right side is extremely weak, and I don't have a ride. It's kind of far for my follow-up
Okay.
visit. I'm in a rural area, and I have a hard time getting somebody to give me a ride. So, I only have in-home care for about an hour or 2 a day,
Okay.
and I'm I'm having a hard time because, as you can tell, it's a little hard to get all of my words out. Sometimes the saying things wrong,
Okay.
and, um, I'm afraid my foot I'm afraid I might
Okay.
fall, and my, my right hand is my my writing hand, and I to cook and
Mhm.
clean my right hand, so I'm using my left hand more now, and my right foot is weak, and I'm afraid I'll fall or get hurt.
Okay. Okay. All very valid concerns. You mentioned you have somebody who comes in for about an hour a day. What are they doing when they come in to help you?
Um, they're assessing my mobility,
Mhm.
taking a set of vital signs,
Okay.
assessing my mobility, helping with medications, maybe
Okay.
opening the package,
Okay.
and making sure that my medications are laid out right. And then sometimes they might help me set up a meal, like put a meal on a plate so that I
Okay.
can eat through the day, or um I think that I think that mostly.
Okay. So anybody who comes in, are they doing any like physical therapy type exercises with you? Anything to help your hand, your right hand be able to grip a pen or a pencil or writing? Are they somebody who's coming in, are they doing any of those things?
Not yet. When I got discharged, they said that somebody would be following up and I
Mhm.
might have PT, but I haven't had that phone call yet.
Phone call, yeah. And you said this was in your discharge was just 4 days ago.
4 days ago. So one of the things was getting help with physical therapy.
Okay. So you you have somebody coming in. We're still waiting on the physical and probably some occupational or speech therapy as well.
I
And
hope so.
y-
Maybe that's something you could help me with.
yes, yes, we can definitely that is something definitely we can do. We can work with the teams and we can get some what we have to do an evaluation first, but I think that wouldn't be a problem to get the evaluation and get you those additional therapies. You mentioned you have somebody coming in though to help us with those little things of like getting a meal set up, making sure your medications are just to confirm, I have a list here of what your medications you were discharged with. I see a cholesterol medicine on here, and you should be taking that one, I think, at bedtime. Does that sound about right?
Yes.
And then I see two different medications here for your blood pressure.
Yes.
Yeah, in taking those.
Yeah.
Um,
Sometimes after I take one of my blood pressure medications, I feel a little dizzy,
you
and
feel a little
I'm worried
dizzy.
about the fall with that.
Okay. And you said the people coming in to help, they take your blood pressure and everything. Have you noticed if any of your blood pressure numbers have been a little low?
Yeah, she took my blood pressure yesterday, and she said my blood pressure was a little lower than usual.
Okay, that may be something we need to look into as far as the dosage of
Okay.
those blood pressure medications. Let me make a quick note of that's what I'm just writing down. I'm just making a quick note that we need to check those. And what I may do, I can send you some information, a link to have you send me a copy of those blood pressure readings so we can take a look at those
Okay.
and we'll work from there.
I
But
should also say too that my daughter comes sometimes after work and
okay,
helps with like house things, maybe helps me with laundry or helps me get a
okay,
shower. Um, but she's not a nurse like the person who comes from the
okay,
hospital. She comes
okay,
and spends time with me and maybe helps me with mostly with like laundry and a shower and making sure I'm safe for the
okay.
nighttime.
Does she help you with picking up groceries, with medicines, or does the nurse aide help you with those?
My daughter does a lot of that.
Okay, she does a lot of that. Have you recently fallen since you've been home from the hospital?
I haven't fallen, but like I said, I get a little dizzy and my right foot feels kind of numb and tingly
Okay,
and I don't get up and walk very much because I'm so nervous and I'm hopeful that we can set up a PT, a
oh,
physical
absolutely.
therapy, so that I can try to practice because I don't wanna get too weak or I mean, I'm already feeling so weak.
Do you use a walker or a cane?
No, but that might be helpful.
Okay.
I don't know how to get one.
We will definitely that is something we can work definitely with physical therapy and making sure that you have what we call medical equipment. That's a walker, a cane, anything like that. We will work with them to ensure that you have those items as you need them. That very important. That should help. Having a walker or a cane may actually help a little bit with your mobility as you regain some of your strength.
Yeah,
Um,
I really wanna be able to do things on my own.
oh,
I'm a
sure,
really
absolutely.
independent person.
Yeah, absolutely. As far as back to your medications, I really only saw the cholesterol medication, the 2 blood pressure medications. I saw some Tylenol here as you need it for any pain.
I
Has that
haven't
been
been
effective?
experiencing any pain,
Okay.
just kind of the numbness and tingling that comes and goes. Sometimes it wakes me up at night,
Okay.
but the Tylenol doesn't really help with that.
With that. Um, are you those were really the only other meds I saw besides some vitamin D. I saw that on your medication list. I didn't see anything for blood sugar for diabetes. To my knowledge, well, to your knowledge and my knowledge, had you ever been diagnosed with any high blood sugars?
No, I never had blood sugar issues. I was but I was a smoker in the past and I quit about
Okay.
7 years ago. And so, that's in my history, but I've been able to control my blood sugars on my own.
Okay. I was just confirming because, like I said, I hadn't seen anything, and they sometimes diabetes can contribute to a stroke. Um, are you taking any other medications that weren't listed on here? Anything
No,
new? Okay. All right. And then you said Tylenol did not help the numbness or tingling and it's intermittent. Is anything making that numbness or tingling better or worse?
sometimes I try to wiggle my feet, or if my daughter's here, she'll rub my foot for me, and that helps a little bit. Um, they mentioned trying to focus on my movement while looking at my extremity so that I'm connecting my brain to the movement, but I don't know a lot about that. It still feels confusing.
Okay. Okay. That is something we can definitely work on with you, and we'll work with the physical therapy for that for sure. W Do you have any specific medical equipment like a shower chair, what we call a reacher or grabber? It looks like a stick with a little grabber on the end that helps you reach high things. Do you have any specific anything like that that you were given
Oh,
when you left the hospital?
no, that sounds wonderful.
Yeah, yeah. The some of our physical and occupational therapists have some great little tools that can help us with our activities of daily living. Um, do you have like a smartphone or a cell phone that you carry with you?
I do. I have my cell phone. I've always been in tech and have had a high tech, career. I
Mhm.
just have a hard time with my right hand now, and so what I used to be able to do on my phone is a little bit limited, but I can still use it and access apps. I'm just a little bit slow.
Because sometimes, some of our newer smartphones, they have an emergency button on there that would call for help, even 911, if something were to happen, say you had a fall. And I just wanted to make sure
Oh,
that you had a cell phone that you carry with you in case something happened and you needed to get help right away.
you
So
know
that,
what? I have a watch that I haven't used in a long time. It's just been sitting in a drawer, an Apple Watch
okay.
that I could connect to my phone, but I haven't used it in so long. I kind of forgot I had it, but that would be on me. So maybe it
Yes.
would be helpful because
Yes.
it's sometimes hard for me to carry my phone around. So
Do
maybe that could be on me. I can have my daughter help me kind of get it set up again. It's been in a drawer for a long time.
So if she can help you set it up there, I do know Apple has a number of apps, including an emergency response if you had a fall where
Oh,
you literally
wow.
just hit a button on your phone and it calls for help.
I didn't know that. That's great
So
to know.
that would definitely be something to work with your daughter to get that set up as we continue to recover. So
Okay.
I want to make sure that I'm hearing everything that you've told me, that very concerned about your about falling, especially with that right foot kind of having that numbness and tingling, that your right hand doesn't work as well as it used to, and you're still having some trouble speaking and finding the right words.
That's
It
right.
Okay, and then just to confirm, you have somebody who comes in about for an hour or so a day to help you with making sure you've got your medicines, helping you with meal prep. Does that person also help a little bit with some light housekeeping, or is that all mostly your daughter?
She will pick something up for me specific if I need it, but she's not doing any housekeeping. A lot has landed on my daughter, and I'm really worried because she has a family and a job,
Oh,
and I feel like a burden right now.
okay.
And I would love if she didn't have to do as much. And there was too much to plan when I got discharged.
Okay. So we have some options available, and I wanted to run some ideas past you just to see what would be of interest for you. You did mention to me that they were in the process of getting home physical therapy set up. What are your thoughts on about having an occupational therapist who can help you with some of those fine things, like picking up a pen with your right hand and being able to work on having that control where you could write again and start to use, say, that using your hand to help with the apps on the phone. Your occupational therapist helps you with all some of those activities where makes it easier to feed yourself, to get yourself dressed, helps you with those little things.
I would really like that. I feel like it would really take some of the load off of my daughter and would help me get get what I need.
Yeah. The physical therapist what can help you with your mobility, your balance, being able to do more for yourself, to, to get up out of bed, to get up out of a chair, to walk across the room safely, to navigate around as you need to. So that definitely physical therapy, occupational therapy, they often work in tandem. The
Okay.
speech therapist, are you having issues swallowing or swallowing food, water, medicines?
No, I physically can do it.
Mhm.
It's it's making my brain catch up.
So our speech therapist can work with you one-on-one, and they help with best way I can describe it is connecting some of the dots, is helping your brain and your mouth connect again to help you with the words, to help you with speaking. But they also help the brain and the eyes connect to see words on a piece of paper or in a book or a magazine. They also help with the occupational therapist with writing out those words, writing out the alphabet so the eyes, the brain, and the hand all work together. And so if that is something that I personally think could help benefit you
Yeah.
for sure, and we can make arrangements to have those therapists come into your home several times a week. I can't guarantee everybody would be there that somebody is going to be there all the time, but we can definitely work to have, say, physical therapy 2 to 3 days a week, occupational therapy, and the speech. We can make sure that that is all coordinated for you, and that helps keep you safe.
Yeah.
I
And that's something you can help me set up.
Absolutely. And they will also confirm that they'll confirm your medications too. They can also double check that blood pressure, and they report back to our office too with regular updates as to your progress. And I definitely want to evaluate that blood pressure medication. We may just have to adjust the doses a little bit. We can
Okay.
also work with the therapy teams to see about that numbness in the foot. And that could just be a residual item from the stroke, but it also may improve as we get your mobility a little stronger. and work on your balance. If that doesn't improve, we have some options. There are some other therapies and there's some other medications we can do that would help potentially help you as well.
Okay. Um, I think that really helps with pretty much everything. The only thing I can think of that I should bring up is with my right hand being a problem, the like things like brushing my teeth. Sorry, I have a support animal. I forgot to tell you. Is that
Okay.
okay?
Yeah.
Um, I have brushing my teeth is
Mm.
hard, and my daughter's not here in the morning, so I don't have a way to brush my teeth in the morning.
Okay. Well, definitely those fine motor skills, that is something we'll want to definitely bring up to the occupational therapist to help you learn with your right hand or your left hand how to brush your teeth. That is also with the nursing aide who comes in. Definitely ask them for some assistance. They might be able to help you a little bit, especially getting everything set up to put the toothpaste on the toothbrush. Those are things that they potentially can help you with in the mornings of brushing your teeth. You mentioned your support animal. Do you feel like your animal is it a dog?
Yeah, my
Um,
little chihuahua.
A little dog. Okay, so be very mindful that sometimes our pets can be fall or trip hazards. So when
Mm,
you are up and about, that doesn't mean you have to you have to get rid of your chihuahua. Just be very mindful that they could potentially be trip hazards just because of their size and that they get around our feet. So being
mm.
very aware of your surroundings is going to be very important.
Okay, I will. Thank you.
So
That's helpful.
So what I can do to help you is I will follow up on that physical therapy referral that you had from the hospital. I will double check, see where that stands, and hopefully later today I can have somebody call you about get making sure that that is all set up. We will
Okay.
also get in those referrals for the speech therapist and the occupational therapist. That way we can start doing some further training for you to help you with those your daily activities, helping you brush your teeth, write your name again, helping you with your speech to help you with those words again. But we will also, again, the one thing I do want to double check is that blood pressure. So like I said, in the patient portal, I will have a link sent for you that you should just be able to take a picture with your smartphone if you can, and you'll be able to send that link in with the blood pressure readings.
Okay.
If that is something you can do. If you were not able to quite do that, you just reach out through either my phone number or through the portal and let me know, and we will figure out another way to do it. We'll figure something out. Because
Okay.
I'm really concerned about you saying when you get up, you're a little lightheaded and dizzy.
Okay. I should be able to put those numbers in. I keep a little notebook when
Okay,
of all my vital signs,
great.
so
That's
I'll
great to
just
hear.
put those in.
What else can I do to help you from my end?
I think the main things we talked about were PT and OT being able to follow up with me and make appointments and
Mhm.
getting something to help me walk around like a walker or a
Yep,
cane. I think
absolutely.
that you've already done those things and that's my main concern, and given me some really good ideas about how to kind of set myself up for the next morning. So I think you've answered all my questions. I really appreciate it. I feel
You're very
really
welcome.
heard.
What are your thoughts on setting up another virtual appointment in about 2 to 3 weeks to
Okay.
check your progress, to see how you're doing, to make sure that you're still safe? What are your thoughts on that?
That sounds good. How many days do you think it will take before someone can come out? from physical therapy and occupational therapy.
I am really hoping that I can have some answers on the physical therapy aspect of things by the end of the workday today. Usually they will call you to set up a date and a time that they come out, and once I get some better answers, I will make sure that they contact you and get out to your home as soon as we can get it scheduled.
Okay.
Occupational therapy and the speech therapist, those should be very similar, that they will contact you to set up a date and time to come out to your home. And
Okay.
once they have everything set for you, when that initial visit, they will set up a schedule for you of, say, physical therapy will be there Monday, Wednesdays, and Fridays at from 10 to 11. And then maybe your occupational therapist will be Monday, Wednesday, Fridays in the afternoons, or it could be a Tuesday, Wednesday, Thursday. They will set a
Mm.
schedule for you based on your evaluation as to what your needs are.
Okay.
Speech therapy will, again, they'll do the same thing. They'll set up specific days and times that they come to see you on these days at these times. So that what they kind of control how that schedule works. But again, with physical therapy, I'm going to make sure I will do that before the end of the business day today, and I'm really hoping, I'll keep my fingers crossed, that you have a phone call either the end of the day or first thing in the morning as to when somebody will be coming out.
Okay. And
Sometimes
then
those referrals take a little while to process, but I will, you've heard of the squeaky wheel getting a little grease. I'm gonna see if the squeaky wheel can, get moved on a little faster here for
that's
you.
great. And then my doctor or who will let me know about my blood pressure medication?
So once we review everything and review those blood pressure numbers, somebody from this office, either me or one of the other nurses, will reach out to you regarding a medication change, that we may
Mm.
have you, instead of taking the one blood pressure med twice a day, we may only have you go down to once a day and see how your numbers work from that. We may just opt to go with a different dosage twice a day. So I need to see those numbers first, but you will hear from somebody within the office on any changes on your medication.
Okay, thank you so much. That's very clear.
So so what I will do is I will have our scheduler contact you probably tomorrow regarding a follow-up appointment virtually in 2 to 3 weeks. Did the virtual aspect of everything, being able to do this from your home, how was this for you? Did this work okay?
Very well. I wouldn't have been able to come in today, so I wouldn't have been able to get seen. I'm so thankful that you can, get some people to come help me from here. I didn't have to come in.
Yeah. So, and if this continues to work for you, we can do many of our follow-up visits this way. We still may need to have, we was definitely will still need to have some in-person visits, but what we can do with that, we can also coordinate an appointment time with your daughter as to, or a ride to be able to bring you into the office. So we can
Okay.
definitely, we'll coordinate that as it gets closer to the actual in-person visit.
Okay, thank you so much.
You're welcome. What other questions can I answer for you? Because our time is almost done. So what other questions could I answer for you today?
I feel good. I feel like those were my last couple questions that came up, and we got to touch base on those, so I'm very thankful.
Great. So expect to hear from somebody within physical therapy, hopefully within the next end of today or first thing tomorrow. Our scheduler will probably call you tomorrow to set up the next virtual appointment. And I will work on those referrals for your occupational therapy and your speech therapy. And they will call you. Usually it takes a couple of days usually for those to process. So expect to hear from them. Today is Friday, so you might not hear from them until Tuesday.
Okay.
All right. Well, if you have no other questions, I will be sending you the after visit summary through the patient portal, and it will have some additional phone numbers and contact information should you need something. And hopefully, the physical therapists, if I can find their phone number, I will make sure to put that phone number in the after visit summary for you as well.
Great. Thank you
All
so
right.
much.
Well, you have a great rest of your day. Be safe. And please feel free to call our office at any time should you need us. We are here to help you. And if you don't have any other questions, I will end the end the video chat.
Okay. Thank you.
You're
Have
very
a good
welcome. You have a
day.
great day.